Do you need 5,000, 10,000, 20,000 steps per day to protect your vision and health? In this video, I'm going to summarize the latest clinical studies we have on walking and exercise on our vision and health. And I'm going to tell you how many steps you need in one day to maximize the beneficial health effects of walking. By the way, I'm Dr. Michael Chua. I'm a board-certified ophthalmologist with Puente Hills Eye Care, and I make videos to help you see better, look better, and feel better too. So even beyond our eyes and our vision, walking has been shown to be one of the most powerful ways we can feel younger and live longer. I mean, the mechanisms behind the positive effects of walking on our longevity have been well studied. Walking improves our heart health by improving our heart rate, lowering our blood pressure, and helps to maintain the elasticity of our blood vessels and reduces the stiffness of our arteries. Walking helps to regulate our blood sugar levels and helps prevent insulin resistance by making our muscle cells more sensitive to insulin. It strengthens our bones and our muscles, reducing the risk of frailty, osteoporosis, and fractures. It improves our immune system, our sleep and circadian rhythms, and it's been shown to decrease the risk of dementia and cognitive decline. The list goes on and on. A recent 2021 study from the journal JAMA Network Open backs these benefits up. Researchers followed 2,110 adults over an average of 10.8 years and found that people who walked at least 7,000 steps per day had a 50 to 70% decrease in mortality compared with people who walked less than 7,000 steps per day. Sure, you can say that perhaps it's not walking per se that makes people live longer. Maybe it's that people who walk more happen to smoke less, or weigh less, or have a lower prevalence of diabetes, or drink less alcohol. And maybe it's those other factors that are really moving the needle. And that may be true, but researchers in this study used specific statistical methods called multivariate analysis to factor in other variables such as age, race, sex, education, body mass index, smoking, alcohol, systolic blood pressure, hypertension, medication use, diabetes, hyperlipidemia, history of cardiovascular disease, and self-rated health. And even after they statistically accounted and adjusted for all these variables, they still saw that 50 to 70% decrease in mortality. The other interesting finding that the researchers shared was that there was a dose-dependent effect of steps on longevity. That is, as you took more and more steps per day until about 10,000 steps, the risk of death continued to decrease. At around 10,000 steps per day, you actually do begin to see diminishing returns or even some loss of mortality benefit. And when they pooled all the research subjects together, they found that people who walked anywhere from 7,000 to 10,000 steps per day had a 0.28 risk of mortality compared to people who walked less than 7,000 steps per day, meaning that they decreased their risk of death by 72%. That's an astounding number. If you could somehow bottle up the incredible effects of daily walking into a pill, it would probably be one of the most successful medications in history. And with smartphones, fitness watches, and all sorts of wearable technology, it's super easy and convenient to track our steps each day. 7,000 steps comes out to about 3.3 miles, depending on your stride length, of course. 3.3 miles per day. That comes out to about an hour or an hour and 10 minutes of dedicated walking per day. These incredible results aren't just from a one-off study. These effects have been replicated multiple times in several studies across different time points from different countries. For example, a different 2020 study in the Journal of the American Medical Association followed 4,840 participants and found that people who walked 8,000 steps per day had a 51% decrease in their risk of death compared to people who walked 4,000 steps per day. So, okay, we get it. Daily walking of 7,000 or 8,000 steps or more per day can literally save your life. But what do these studies say about walking and our vision? First, let's talk about which eye conditions are the ones that are affecting our vision on a large scale. The leading causes of vision impairment and blindness in the United States are primarily age-related eye diseases, namely age-related macular degeneration, cataracts, diabetic retinopathy, and glaucoma. Thankfully, cataracts are a problem we can solve with surgery. But for the other three diseases, we don't have a cure. All we can try to do for these chronic conditions is try to manage them as best as possible to try to stop their progression. So I think there's a lot of value in reading up on the research and looking at the best ways we can prevent these diseases from occurring or progressing. And as it turns out, more and more evidence is showing us that walking is one of the most effective ways that we know about that can have a meaningful impact on our risk of vision loss. Let's start with diabetes and diabetic eye disease. In diabetes, what we see is that many of our cells have become insulin resistant. That is, When there's high glucose or sugar in the blood, our pancreas secretes a hormone called insulin, which helps the cells shuttle the glucose from our bloodstream into our muscles and organs. But over time, if we continue to eat lots of foods with added sugars and are sedentary, then there's an overflow of glucose in our bloodstream. Our pancreas can't keep up with secreting enough insulin to push it into our cells, and the cells in our muscles and organs, they start becoming numb or resistant to the insulin. Mildly elevated blood sugar levels aren't dangerous in the short term, but if we continue to have elevated glucose levels for years or decades, then this high level of sugar in the blood can begin to damage the tiny blood vessels supplying our retinas, our kidneys, our nerves, and our brain. These damaged blood vessels in our eyes can lead to bleeding and swelling in our retina, a condition we call diabetic retinopathy. And sometimes, unfortunately, the vision damage from diabetic retinopathy can be irreversible. So this study, published in 2020 from a research team out of Sweden, investigated whether patient daily step counts had an effect on the risk of developing diabetes. They looked at a group of 3,055 70-year-olds, all of whom did not have a history of diabetes. They gave each of these subjects a step counter and followed them to see whether average step count influenced their risk of eventually developing diabetes over the next 2 or 3 years. They found similar findings that we saw in our first study. After statistically adjusting for other variables such as sex, education, BMI, and cardiovascular risk factors, they found a protective effect of walking and developing diabetes. They saw a decrease in the risk of developing diabetes as patients walked more steps per day, and these effects started to level off around 8,000 steps per day. When they stratified the subjects based on how many steps per day everyone walked, we see that people who walked at least 6,500 steps per day had a 0.43 risk of developing diabetes compared to people who walked less than 4,500 steps per day, or basically a risk reduction of 57%. And in people who walked at least 8,500 steps per day, we see a 0.37 risk, or a 63% risk reduction, compared to those who walked less than 4,500 steps per day. The magnitude of these effects are large and clinically meaningful. Okay, so that's some of the most recent data we have on walking and developing diabetes. It seems like at the range of about 8,000 steps per day, we can maximize the protective effect of walking on our risk of developing diabetes and subsequent diabetic eye disease. But what if you already have a diagnosis of diabetes? What research is out there regarding walking or physical activity in influencing our risk of developing diabetic retinopathy and vision loss? In this review, published in 2019, researchers looked at all the prior studies on physical activity and risk of diabetic retinopathy. They found that in patients with diabetes, physical activity had a protective association with diabetic retinopathy. And this protective impact of exercise was even more pronounced in protecting against what's called vision-threatening diabetic retinopathy, or diabetic retinopathy that's severe enough to cause vision loss. Okay, so more time walking and exercising helps protect us from diabetes and diabetic eye disease. What about glaucoma? Before we talk about what the latest research says about exercise and glaucoma, I want to tell you about my optimized newsletter. If you want to get the latest science-backed information on how to improve your vision and health delivered straight to your email, you can visit my website at michaelchuamd.com to sign up. Okay, in glaucoma, what we usually see is that there's an increase in eye pressure and subsequent damage to the optic nerve in the back of the eye. This damage to the optic nerve can cause loss of peripheral vision, and if it's left untreated, it can cause outright blindness. We eye doctors measure the amount of peripheral vision loss by completing a test called a visual field test. With visual field testing, we use specially calibrated computers to measure exactly how your peripheral vision is doing. In this study from the journal Ophthalmology in 2019, from researchers at Johns Hopkins, scientists wanted to determine whether walking could help protect patients with glaucoma from losing vision. They looked at 141 research subjects and gave each of them accelerometers so they could measure how much each person walked per day. When they crunched the numbers, they found that each 1,000 step increase per day significantly decreased the rate of visual field damage in these patients with glaucoma. They found that an additional 5,000 daily steps decreased the average rate of vision loss by 10%. Although more studies need to be done to confirm these findings, these results suggest that more walking, more physical activity is a powerful lifestyle choice we can make to help prevent vision loss from glaucoma. Okay, so we have some pretty convincing data about the benefits of walking on longevity, diabetes, diabetic retinopathy, and glaucoma. What about for macular degeneration? One report from the Beaver Dam eye study helped to shed some light on the relationship between exercise and walking and risk of developing macular degeneration. The Beaver Dam eye study is one of the most comprehensive, longest-running epidemiological studies that we have in all of human history that aims to gather data on the prevalence and incidence of age-related eye conditions like cataracts, macular degeneration, and glaucoma. It was started in 1987 by Dr. Ronald and Barbara Klein, professors at the University of Wisconsin in the city of Beaver Dam, Wisconsin, and it's still going on to this day. So at this point, it has already been going for over 35 years. Researchers have been following thousands of patients for all these years, and these research subjects have received detailed eye exams, retinal photography, as well as general health evaluations and questionnaires. All of this data has been a treasure trove of information, and the Beaver Dam eye study has supplied us eye doctors with valuable insights into the natural history and risk factors of major eye diseases. A report published in the British Journal of Ophthalmology from the Beaver Dam eye study team looked at whether there was a relationship between physical activity and walking on the risk of developing macular degeneration. In this report, they gathered information on 3,874 research participants for 15 years. They found that people with an active lifestyle, which they defined as regular physical activity at least 3 times per week, had an odds ratio of 0.3 of developing wet macular degeneration compared to people who were not as active. That's a 70% decrease in the odds of developing wet macular degeneration. And this was after controlling for other possible confounding variables like age, sex, blood pressure, BMI, smoking, and education. When researchers investigated walking specifically, they found that people who reported that they walked at least 12 blocks per day had a 0.7 odds of developing wet macular degeneration compared to those who did not report significant walking per day. So a 30% decrease in the odds of developing wet AMD in walkers. And a more recent meta-analysis published in the American Journal of Ophthalmology looked at all the previous studies investigating the relationship between physical activity and age-related macular degeneration. They found that increased physical activity had a significantly protective association with early macular degeneration, an odds ratio of 0.92, or a decrease of 8% of developing early macular degeneration. And they also saw this protective effect of physical activity on developing late macular degeneration also. They reported an odds ratio of 0.59, or a decrease of 41% in the odds of developing late macular degeneration in people with increased physical activity. Great, so we're making the case of physical activity helping to protect us against macular degeneration too. What about for cataracts? Well, this meta-analysis published in the International Journal of Ophthalmology reviewed all the prior research done on physical activity and risk of developing age-related cataracts. After putting all the results together, they found that increased physical activity was significantly associated with a 10% decreased risk of age-related cataract. So if we zoom out, we see that across the board, increasing our steps and physical activity per day helps to provide a protective effect. Those daily steps help us live longer, prevent diabetes, prevent macular degeneration, glaucoma, and cataracts. And although not every study had exact step counts, we found that in the studies that did measure step counts in patients, we saw increasing protective effects up to the 7,000 to 8,000 step range. After that point, we saw some evidence of diminishing returns or leveling off of the advantages of daily walking. So that's the step count we can aim for, about 7,500 steps per day, which translates to 3.5 miles a day or 5.5 kilometers per day, or about an hour and 10 minutes of walking per day to keep your body and eyes in tip-top shape. I hope this was a useful scientific review for you and you learned something that can help you live a healthier life. If you live in the Los Angeles, Orange County, or Inland Empire area and want an eye exam, feel free to visit our website or give our phone number a call to make an appointment today. And if you made it this far into the video, that means you're probably really interested in maintaining your vision and health. You can watch my video here to learn about the best ways to prevent glaucoma. I'm Dr. Michael Chua with Puente Hills Eye Care. See you next time.